Welcome back, everyone, to another deep dive.
Yeah.
Today we'll be tackling something pretty interesting in cardiology. And big thanks to London Heartbeat Z Academy over in the UK for the material today.
Oh, yeah. They're fantastic.
We're going to be kind of unraveling the mysteries of supraventricular tachycardia, or SVT for short.
SVT, yeah.
And, it's a condition that causes those sudden, rapid heartbeats that
Yeah.
can be a bit alarming.
Yeah, it can be a bit scary.
Yeah, so what exactly is happening when someone has SVT?
So basically what it comes down to is the electrical system that controls your heart's rhythm.
Okay.
Think of it like the wiring in your house. So if there's a short circuit or a faulty connection, the lights might start flickering or, going haywire.
Right.
And in SVT, there's an extra or abnormal electrical pathway in the heart,
Okay.
causing signals to go off course and trigger those really fast heartbeats.
So it's not just that the heart's beating too fast, it's that the signals are getting messed up.
Exactly.
Yeah.
It's that the signals are getting messed up, and that's why it's so important to figure out exactly what type of SVT is causing the trouble.
Oh.
The most common types are AVNRT, AVRT, and AT,
Okay.
and each one involves a slightly different electrical pathway.
So it's like having different wiring problems in your house.
Yeah.
You need to know which wire is causing the issue
Exactly. You need to know which wire is causing the issue.
before you can fix it.
Before you can fix it, that's exactly right.
Okay.
And that's where this research from London Heartbeat's Z Academy comes in.
Okay.
They've outlined the steps doctors take to pinpoint the cause of the patient's SVT. And it's really like a detective story,
I love it.
using clues from the heart's electrical activity to solve the mystery.
I love a good medical mystery.
Mm.
So walk me through this electrophysiology lab where this is all happening. What's the first clue the doctors look for?
Well, first, they analyze the heart's electrical activity during normal rhythm, which is called sinus rhythm.
Okay.
Think of it like your heart's resting, EKG, the baseline reading.
Okay. So that's the starting point.
Right.
What do they look for in that baseline reading?
They're looking for patterns of activation, how the electrical signal spreads through the heart.
Oh.
Is it spreading smoothly and evenly? Or is it taking some kind of detour?
So like traffic flowing on a highway versus getting rerouted through like a back road.
Perfect analogy. That's
Yeah.
exactly right. Doctors call this concentric versus eccentric activation.
Okay.
Concentric is like that smooth highway flow where the signal spreads outwards from the heart's natural pacemaker.
Okay.
But if there's an extra pathway involved, the signal might take a detour,
Right.
creating that eccentric activation pattern.
Uh-huh. So that's a pretty big clue.
Yeah,
If there's an eccentric activation pattern, it means there's probably an extra pathway causing trouble.
exactly right.
Okay.
And if the ventricles, the lower chambers of the heart, are getting activated a bit too early during this normal rhythm, it's a strong indicator of AVRT.
Oh, really?
And in fact, this early activation or pre-excitation has an 86% chance of indicating AVRT.
Wow, that's a pretty high percentage. So just by observing the heart in its normal rhythm, they can get a good idea of what they're dealing with.
Exactly, but it doesn't stop there. They need to see what happens during the tachycardia itself.
Oh, okay.
Those bursts of rapid heartbeat.
Okay, so this is where things get really interesting.
This is where it gets really interesting.
What do they look for during those rapid heartbeat episodes?
Well, they analyze a few factors, like the rate of the heartbeat. For example, a slower SVT
No.
with a cycle length over 500 milliseconds
Okay.
is more likely to be AVNRT.
So the speed of those rapid beats can be another clue.
Exactly. Another key factor is the VA interval,
Hmm.
which is the time between the activation of the ventricles and the activation of the atria.
Cool.
A very short VA interval almost certainly rules out AVRT.
Wow. It's fascinating how these tiny differences in timing can reveal so much. It really is like a high-tech detective story.
It really is. They also pay close attention to something called the atrial activation pattern.
Okay.
During the tachycardia, again, it's about looking for that concentric versus eccentric activation pattern.
Uh-huh.
If it's eccentric during those rapid beats, it often points to AVRT or AT.
Gotcha. So we've seen how observing the heart's natural behavior
Yes.
during both normal rhythm and tachycardia
Right.
provides some clues.
Yes.
But I bet the investigation doesn't end there.
You are correct. The next step is to actually see how the heart responds to some specific maneuvers.
Okay.
Doctors can use certain techniques to further isolate the cause of the SVT.
All right. Now we're getting to the good part.
Okay.
Tell me about these maneuvers. What's the first one on the list?
Well, one of the most interesting techniques is using something called synchronous premature ventricular contractions, or PVCs.
Okay.
Now, don't let the name scare you.
Okay, good. I was getting a little worried.
It's not as complicated as it sounds.
All right. Break it down for me. What are these synchronous PVCs and how do they help?
So imagine the His bundle as a crucial relay station in the heart's electrical system. It sits between the atria and the ventricles, helping to coordinate the signals. With this technique, doctors can deliver a precisely timed electrical impulse.
Okay.
That's the PVC right when the His bundle is activated.
So it's like sending a little zap at a specific moment.
Exactly. And by doing so, they can reveal the presence of an accessory pathway.
Okay.
That extra electrical connection we talked about earlier. Yeah.
So it's a way to see if those signals are taking a shortcut.
Precisely.
Yeah.
If the next atrial signal arrives earlier than expected after the PVC, it means that the signal took that shortcut through the accessory pathway.
So it's like they set a trap and the heart's electrical signal falls right into it.
That's a great way to put it. And sometimes delivering this precisely timed impulse can even stop the tachycardia altogether.
Oh, wow.
Which is a clear sign that the accessory pathway is not just present, but it's also the main culprit behind those rapid heartbeats.
It's like they're playing a high-stakes game with the heart's electrical system.
That's right.
But in a good way.
In a good way.
It's all about manipulating those electrical signals just slightly.
Yes.
To gather the information they need to make a precise diagnosis.
Exactly.
This is getting exciting. So they've observed the heart's natural rhythm. They've sent in those precisely timed PVCs.
Right.
What other tricks do they have up their sleeve?
Well, there's another tool they use called the pre-excitation index, or PI.
Okay.
This one also involves delivering PVCs, but not necessarily timed to the His bundle. They deliver the PVC a bit earlier and see how it affects the tachycardia.
Okay.
The degree of prematurity needed to advance the next atrial signal helps differentiate between AVNRT and AVRT, and can even help to locate the accessory pathway.
So it's like they're trying out different variations of those electrical impulses to see how the heart responds.
Exactly. And the research from London Heartbeats Z Academy mentions two ways to calculate this index. PI1 and PI2.
Okay.
They both use the timing of the PVC and the tachycardia cycle length.
Okay.
But it seems that PI1 is the more reliable measurement.
Interesting. It's amazing how these tiny variations can reveal so much.
Okay.
So what's next in their arsenal of maneuvers?
Another technique is called entrainment from the ventricle.
Okay.
In this one, they pace the ventricle slightly faster than the SVT.
Okay.
And observe how the heart responds.
Entrainment. So they're trying to get the heart to follow your lead.
You got it. They're looking for specific patterns in the heart's response to this pacing, like a VAAV or a VAVA pattern.
Okay.
These patterns can help distinguish AVNRT from other types of SVT.
It's like they're having a conversation with the heart's electrical system, trying to understand its language.
It's a great way to put it. And the post-pacing interval.
Okay.
That's the time it takes for the heart to return to its regular rhythm after the pacing stops.
Okay.
Is another clue. A longer post-pacing interval is more typical of AVNRT, while a shorter one points to AVRT. It's like seeing how long it takes for the heart to catch its breath after that pacing exercise.
Wow. They really are squeezing every bit of information they can get from these maneuvers.
Absolutely. And each piece brings them closer to identifying the true cause of the SVT.
This is all so incredibly intricate.
It is.
But I have a feeling we've only just scratched the surface of these diagnostic techniques.
We've got plenty more to explore.
All right, let's take a quick pause here just to let all this information sink in. And when we come back, we'll delve into even more fascinating aspects of SVT diagnosis.
Looking forward to it.
All thanks to London Heartbeats Z Academy. Stay tuned.
Yes.
We'll be right back.
Absolutely.
Welcome back to our deep dive into the world of SVT. Before the break, we were talking about those fascinating maneuvers doctors use to really pinpoint the cause of those rapid heartbeats, and I'm eager to hear more. It's amazing how much information they can get from just a few well-timed electrical impulses.
It is. It really speaks to the ingenuity of these cardiac electrophysiologists. They've developed some truly elegant techniques to unravel those electrical mysteries.
Let's unravel some more. What other maneuvers do they have in their toolbox?
Okay, well, there's another maneuver called assessing AV nodal dependence.
Okay.
And this helps determine if the AV node, that crucial pathway between the atria and the ventricles, is playing a role in the tachycardia.
Okay. Remind me again why the AV node is so important.
Sure. So the AV node is like the gatekeeper between the upper and lower chambers of the heart.
Right.
It helps regulate the flow of electrical signals, making sure the heart beats in a coordinated way. But sometimes that gatekeeper can get a little overzealous, and that can contribute to those rapid heartbeats we see in SVT.
So with this maneuver, they're trying to figure out if the AV node is part of the problem or just an innocent bystander.
Exactly. They do this by looking at these subtle variations in the heart's rhythm.
Okay.
You see, SVTs almost always have some slight changes in their cycle length, especially at the beginning and end of the episode.
So those rapid heartbeats aren't always perfectly consistent.
Right. They fluctuate a tiny bit, and those fluctuations can tell us a lot. Doctors pay close attention to the timing of the signals in both the atria and ventricles,
Okay.
looking for clues about how the AV node might be influencing those variations.
So they're analyzing those tiny inconsistencies in the rhythm to see if the AV node is calling the shots, so to speak.
Exactly. If the variations in the timing of the signals in the ventricles are directly related to the variations in the atria, it means the tachycardia is dependent on the AV node.
Okay.
And this can help them rule out atrial tachycardia, which originates in the atria and doesn't rely on the AV node for its rhythm.
Ah. So it's another way to narrow down the possibilities. I'm starting to see how all these pieces fit together like a complex puzzle. What other pieces of this puzzle do we need to explore?
Well, let's move on to another specialized maneuver called the resetting zone.
Resetting zone sounds intriguing. Tell me more.
Remember how we talked about ventricular overdrive pacing,
Yes.
where doctors stimulate the ventricle faster than the tachycardia to see how the heart responds?
Yes, it was like they were hitting the reset button on the heart's rhythm.
Exactly. But sometimes that reset button works a little too well, and the pacing actually stops the tachycardia completely,
Oh.
which makes it harder to analyze what was happening before the reset. So that's where the resetting zone maneuver comes in.
Oh.
It focuses on this transition zone, that brief period where the heart's rhythm is shifting between the paced rhythm and the tachycardia.
So it's like they're zooming in on that critical moment when the heart's electrical system is switching gears.
Precisely. They analyze how many paced beats it takes for the heart to fully switch over to the pacing rhythm.
Yep.
It's a bit like measuring the heart's reprogramming time.
Interesting. And what have they learned from this maneuver?
Well, research shows that with AVNRT, it typically takes more paced beats to reset the tachycardia compared to AVRT.
So AVRT is a bit more readily influenced by pacing. I wonder why that is.
It has to do with the location of the culprit, that extra electrical pathway.
Oh?
In AVRT, the circuit causing the rapid heartbeat involves an accessory pathway, and these pathways are often located closer to the ventricle. So when you pace from the ventricle, it's easier to influence that circuit and reset the tachycardia.
It's a matter of proximity. The closer the pacing site is to the problem area, the easier it is to disrupt those rapid heartbeats.
Exactly. It's a great example of how understanding the anatomy of the heart's electrical system helps doctors to fine-tune these diagnostic techniques.
This is all so fascinating, and I really appreciate how London Heartbeat's Z Academy has presented this research in such a clear and engaging way. It's amazing how much progress has been made in understanding and treating heart rhythm disorders.
Absolutely. And it highlights the importance of collaboration between researchers, clinicians, and educators like London Heartbeat's Z Academy. It's this kind of collaborative effort that leads to better diagnosis and treatment for patients.
Speaking of diagnosis, are there any other maneuvers we need to cover before we move on to treatment?
Yes. There's one more detail I want to highlight from the research.
Okay.
It's something called Calmel's law.
Calmel's law sounds intriguing. What's that all about?
It's a clever observation that links the location of a specific type of heart block to the location of an accessory pathway.
Okay, back up for a second. Remind me what a heart block is.
Sure. A heart block occurs when the electrical signals in the heart are delayed or blocked, usually at the AV node. Think of it like a traffic jam in the heart's electrical system.
Right. The bundle branches are those pathways that carry the electrical signal through the ventricles.
Exactly. Now, Calmel's law states that if you see a bundle branch block develop during an SVT episode and the VA interval gets longer, it strongly suggests that the SVT is AVRT, and it helps pinpoint the location of that accessory pathway.
Wait, so the appearance of this block is actually a helpful clue?
Yes. It's like the heart is giving away a secret about the location of the troublemaker. The block tends to appear on the same side as the accessory pathway.
That's amazing. So by observing which bundle branch is blocked, doctors can deduce where that extra pathway is hiding.
Precisely. It's another example of how even seemingly abnormal events in the heart's rhythm can provide valuable information for diagnosis. And it really showcases the brilliance of pioneers like Calmel, who made these important observations.
It's incredible how intricate and interconnected the heart's electrical system is. It's like a beautifully orchestrated symphony, and even the slightest discordance can provide valuable clues.
That's a great analogy. And it underscores the importance of careful observation and analysis in the electrophysiology lab. Every detail matters in this cardiac detective work.
Well, we've covered a lot of ground in this deep dive into the diagnosis of SVT, and I feel like I've gained a whole new appreciation for the complexity of this condition.
Me too. It's been a pleasure to delve into these intricacies with you.
Before we wrap up this episode, I want to give another huge thanks to London Heartbeat's Z Academy for sharing this incredible research with us.
Absolutely.
Their dedication to medical education is truly making a difference.
I completely agree. They've done a fantastic job of making this complex topic accessible to a wider audience.
Now let's take a quick pause to gather our thoughts before we move on to the final part of our deep dive. We'll explore how all of this diagnostic information is used to guide treatment decisions, and with the insights from London Heartbeat's Z Academy. I'm sure it will be an eye-opening discussion. Stay tuned. Welcome back to the deep dive. It's been really amazing learning about the diagnosis of SVT.
It really is fascinating, isn't it?
Yeah, it's pretty incredible. And again, thanks to London Heartbeat Z Academy for the material.
Yeah, they do such good work over there.
They do. So we've seen how doctors gather all these clues, analyze rhythms, manipulate electrical signals to make a diagnosis. But what happens next?
Right. That's the important part, isn't it?
Right.
Taking all that information and using it to actually help patients.
Right.
And in most cases, that involves a procedure called radiofrequency ablation, or RFA for short.
Right. We touched on that earlier. It's this dipping technique that disrupts those pathways.
Exactly. And it's truly revolutionized treatment for SVT.
Mm.
It's minimally invasive,
Mm.
it's highly effective, and often provides a permanent solution.
Wow. That sounds almost too good to be true. But I imagine it's not as simple as just zapping anywhere in the heart, right?
You're absolutely right. Precision is key. And that's why all that diagnostic work we talked about is so important. It gives the electrophysiologist a really detailed roadmap, guiding them to the exact spot where they need to apply that RFA energy.
So it's like a personalized treatment plan tailored to the heart's unique electrical fingerprint.
Perfect analogy. That's exactly right. With accurate diagnosis, RFA can target the source of the problem with remarkable accuracy, disrupting those rogue signals and restoring normal rhythm.
That's incredible. It really speaks to the power of medical technology
It does.
and the expertise of these electrophysiologists.
It really does. It's a beautiful blend of science, technology, and human skill.
Yeah.
And the results really speak for themselves. Many people with SVT can live totally normal, active lives,
Wow.
free from those sudden, rapid heartbeats.
That's amazing.
Yeah.
But before we wrap up, I think it's important to emphasize that anyone experiencing symptoms of SVT should seek medical attention right away.
Absolutely. Symptoms like a racing heart dizziness, shortness of breath, even a feeling of fluttering in the chest,
Yeah.
those should never be ignored.
Yeah. You don't want to mess around with the heart?
No, you don't. Early diagnosis and treatment are key for managing SVT effectively.
Right. So listen to your body.
Yes.
And when something feels off,
Absolutely.
go see a doctor.
That's right.
I want to give one last thank you to London Heartbeat's Z Academy for providing us with this incredible material.
Yeah, they're a fantastic resource
They really are.
for anyone interested in learning more about cardiology.
Absolutely. It was fascinating. It's been a pleasure chatting with you.
You too.
And that's all the time we have for today's deep dive into supraventricular tachycardia.
Until next time.
Thanks for joining us, and we'll see you next time for another fascinating journey into the world of knowledge.